I'm Dennis Peacock with another edition of the Transforum. Healthcare, my answer to President Obama's recent speech. And as a general comment, I thought he did a great job. He's a powerful communicator. Now, in terms of handling a lot of objections, I thought he handled that well. There's only one big problem. He did not deal in depth with the major issues, which is how is all this going to work, not the least of which was the funding of this. Anybody that believes that government is going to find quote-unquote savings within any of their systems apparently has not been alive for the last 3,000 years. But beyond that, it's a great idea. Now, the point that I want to make for beginning is very simple. Without incentives and personal responsibility, nothing operates efficiently. I'll say it again. The principle applied to healthcare and anything with dollars and cents involved, and a whole lot of other things, is without incentives and personal responsibility, nothing operates efficiently. What are the needed incentives? Well, patience. You need to stay healthy and receive money for being healthy. The service providers have got to find a way to compensate people for staying healthy. Give them incentives. What about the doctors? Set core salaries and then profit share with the hospitals. Create an incentive not for doctors to recommend more services or unnecessary services, but to be shares in profit sharing with the hospitals or the healthcare system in which they're working. Not based on volume, but based on profit sharing. You need an incentive for the doctors. What about the insurance companies? Well, we need to create national insurance markets. Now, that is something that many people agree on, and President Obama weighed in on it favorably. And let's make price information transparent. Too many of the people involved in the system have no idea what those services cost. So of course they're willing to recommend them, especially if the insurance companies are getting stuck with the bill. How about the government? We need to make basic insurance mandatory. Now again, President Obama talked about that. Exactly what that's going to look like wasn't clear. How do you do it? You contract with the best insurance providers. And you make sure that that system as well has incentives for efficiency. Government spending has no incentive for efficiency. That's why it cannot create capital, neither is it going to give us savings. That's the big difference between hiring for government employment as contrasted with hiring in the private sector. There are no profit incentives in the government. And anything without incentives is going to be like, vacuums tend to be filled with anything that's near. Lastly, we need to cover the uninsured with basic health care services with insurance providers. That has got, again, have incentives in it. If you're going to have mandatory coverage, you have to have some kind of mandatory incentive to make sure that the whole system is based and driven on trying to be productive and profit producing. Hey, read our lips. Incentives, incentives, incentives. That's the only way to begin to change not only the healthcare system, but government itself, especially when it begins to deal and try and interface with the private sector. What do you think? This is the Transforum. Let's engage.